Hello, I'm Alex Steele, anchor at Bloomberg Television, and on behalf of our New Voices program and the Smithsonian's American Women's History Initiative, I'd like to welcome you to the Women in the Room, Science, Technology, and Innovation. I think I speak for everyone when I say that 2020 was an awful year, and the first quarter of 2021 wasn't that great either. You had the coronavirus shuttering economies, killing hundreds of thousands, and wreaking havoc on every aspect of the lives of people around the world. At the same time, we have to remember that we've seen landmark scientific achievements. COVID-19 vaccines developed at historic speeds, delivered to the first U.S. hospitals 9 months after the pandemic began. It was also the year when our reliance on technology became even bigger, as people and companies alike relied on it to stay connected and keep businesses running almost overnight. I solo anchored a 2-hour TV program every morning in my living room, so I truly witnessed that firsthand. And tonight, we wanted to celebrate female leaders in science and technology, those who inspire the next generation of women. The Women in the Room will take us on a journey from the past with a retrospective discussion with Smithsonian experts to better understand the trailblazers who paved the way, to the present, with a riveting panel of 4 superhero doctors. Dr. Kathrin Jansen, Senior Vice President, Head of Vaccine Research and Development at Pfizer. Dr. Fei-Fei Li, Sequoia Professor in the Computer Science Department at Stanford University and co-director of Stanford's Human-Centered AI Institute. Priscilla Chan, Dr. Priscilla Chan, co-founder and co-CEO at the Chan Zuckerberg Initiative, and Dr. Anne Schuchat, Principal Deputy Director of the CDC. We got you covered. We got vaccines, we got AI, technology, and policy, what's happening right now and what will happen in the future with 4 women who are literally in the room helping us survive and thrive out of COVID. And then we're going to end the event exploring specific initiatives that are increasing visibility and empowerment of female leaders in science, technology, and innovation, as well as future generations of female talent. And this includes the Bloomberg New Voices program, our global initiative to amplify the voices of women and other underrepresented executives across our media platforms, as well as Bloomberg corporate philanthropy efforts with young women. Now, I've seen firsthand the benefits of the New Voices program. It not only gives them TV training, but it also helps them find their voice on TV, media platforms, in meetings with bosses and coworkers. And I believe in this program so much. I volunteer through events like these, and I keep asking Lord if I can do even more. Because I really believe that we as women do better when we can support and elevate other women, and the New Voices program does just that. So let's kick it off. Please welcome Lonnie G. Bunch III, 14th Secretary of the Smithsonian.
Hello, I'm Lonnie Bunch, Secretary of the Smithsonian, and on behalf of the entire institution, I'd like to welcome you to the Women in the Room, presented by the Smithsonian American Women's History Initiative and Bloomberg's New Voices. I am excited and proud for the Women's History Initiative to partner again with Bloomberg, to come together once more to discuss how we can champion women's voices and help advocate for change. We know that for too long, we have undervalued women's contributions to this country. It's true in history, in culture, in politics, and especially true in science. Events like today's helps correct that. This collaboration will elevate the stories of women in science, technology, and innovation, stories that are sorely needed. In the next hour, we'll hear from Smithsonian curators about trailblazing women in history whose names may be unknown, but whose work contributed to groundbreaking inventions, discoveries, and healing. And we'll hear from women leading the charge today in pandemic recovery and its response. And we'll hear how our organizations can continue to engage and inspire future generations of trailblazers, innovators, and scientists. The stories that we will hear tonight have an enormous amount to teach us about persistence, about creativity, about strength. I think of women like the Smithsonian's own Sophie Letterloo, a brilliant entomologist. She worked for 14 years as an elevator operator at the National Museum of Natural History, studying insects during her lunch breaks, before she formally joined the museum's scientific and curatorial work. I think of my own daughter, an emergency medicine doctor in Chicago, who works with COVID-19 patients. Throughout this pandemic, she inspired me every day to keep pushing forward, even those moments when I was the most tired. These are the kinds of stories, ordinary and extraordinary, that the Smithsonian American Women's History Initiative and Bloomberg's New Voices lift up. I want to express our gratitude to every person joining us in this vitally important work. And to every person who made this event possible, thank you. Thank you all for joining us, and please enjoy and be made better by the program.
Thank you so much, Lonnie. So let's set the stage for our discussion. Smithsonian curators are going to walk us through stories of the female pioneers who paved the way for women in science, technology, and innovation.
When you're a little girl and you want to be an astronaut when you grow up, it's like wanting to be a policeman when you grow up. Or in some cases, wanting to be a doctor when you grow up. You're told that's not an appropriate goal.
I see the history of medicine and science, for that matter, as the history of women. Courageous women, smart women, pioneers. It's not just Florence Nightingale and Clara Barton, but ordinary women who did and do extraordinary things. I'm Kathrin Jansen, a curator at the Smithsonian's National Museum of American History. Here at the Smithsonian, we tell stories of women in science to correct that emphasis on firsts and onlys and high achievers, like Mary Walker, a surgeon on the battlefields of the Civil War. She's remembered as being a fearless doctor, and she believed in herself. When she married, she kept her own name. She wore men's clothing because they were easier to work in. I totally relate to that. And like many women ahead of their time and with a questioning nature, Walker was involved in social justice issues of her day, the abolition of slavery, women's rights, dress reform. She even tried to vote in 1871, which was nearly 50 years before women could legally cast a ballot. Anna Louise James got the bug to become a pharmacist while working in her brother-in-law's Connecticut pharmacy in the 1890s when she was 16. She liked the personal side of helping and healing people, and she eventually took over the pharmacy, and she lived there in the back up until the day she died when she was 91. Always a rock in her community. Then there's Margaret Chung, known also as Mom Chung, the amazing and legendary Chinatown physician. She treated celebrities, soldiers, politicians, both Asian American and white. These women have all been celebrated as firsts. We love firsts, but through the perspective of women's history, it's not really the firsts that deserve all our gratitude and attention. Women's stories have been so buried and erased and untended. The first of something is likely long lost to us. Today's researcher or practitioner is able to do what she does because of the hundreds of thousands of people who came before her and added their own small pieces to the puzzle. I'm thinking of Dorothy Horstman, for one. She was a Yale scientist trying to figure out how the polio virus traveled through the body, wreaking havoc. This is the 1940s, when polio had been a major killer and an epidemic problem for over 40 years. And despite that, scientists didn't know very much about the disease. Horstman proved that the virus circulated through the bloodstream and into the nervous system, a major breakthrough because it meant a vaccine might work against the disease.
Thanks, Kathrin. Sometimes the solution to a medical problem is right in front of you, especially if you are doing the hands-on care of a nurse, a traditional job for women. I'm Allison Oswald, and I'm an archivist at the National Museum of American History. I document life-changing inventions created by women, many of whom are in our Picturing Women Inventors exhibition. One invention that seems so simple yet so profoundly changed the care of babies in the hospital was the Billy Bonnet, designed and patented by Sharon Rigoni. Rigoni was a neonatal intensive care nurse treating the tiniest of tiny babies. In the late 1990s, nothing babies needed, diapers or pacifiers, came in preemie sizes. So Rigoni invented them and founded a company called Small Beginnings. Her Billy Bonnet was ingenious. Rigoni designed a mask to protect babies' eyes from the harsh lights used to treat jaundice, an elevated level of bilirubin that caused yellow-colored pigment in blood. The bonnet was made of soft mesh that held a spongy mask in place. And Patricia Bath, an ophthalmologist, so strongly believed medical care belonged in the community setting, accessible to all. Her credentials are impressive. First African-American woman to receive a medical patent, train in ophthalmology at Columbia University, and join the surgical staff at UCLA. Yet she was an outspoken champion of the underserved affected by inadequate access to healthcare, an untiring proponent for STEM education for girls, and an inventor. She co-founded the American Institute for the Prevention of Blindness. She invented the laser phaco probe in 1988 to make cataract surgery more accurate and less invasive by using an optical laser fiber to remove cataracts and make smaller incisions in the eyes.
The most important part of this has been having faith and belief in the power of your own ideas.
Truly inspiring. All of these women have amazing stories. Please join us and the Smithsonian's American Women's History Initiative to find out what we will discover next.
I honestly may not make it through this hour without crying. That was very inspiring. And it is my great pleasure to introduce four women who are most definitely and truly in the room. Dr. Kathrin Jansen, Senior Vice President, Head of Vaccine Research and Development at Pfizer. Dr. Fei-Fei Li, Sequoia Professor in the Computer Science Department at Stanford University and Co-Director of Stanford's Human-Centered AI Institute. Dr. Priscilla Chan, Co-Founder and Co-CEO of the Chan Zuckerberg Initiative. And Dr. Anne Schuchat, Principal Deputy Director of the CDC. Ladies, welcome. And if you have any questions in the audience, by the way, please go ahead and ask them in the chat box during the panel, and we'll ask them in the Q&A. Ladies, it is by far the biggest honor to speak to all of four of you, and I truly appreciate your time today. We want to jump right into COVID because that's what we've all been focused on in the last year and a half. And so, Anne, I wanted to start with you. Can you give us some perspective on how you look at the U.S.? Where are we?
Yeah, thanks. And it's such a pleasure to join each of you today. We have come so far, and it has been such a hard time for all Americans and people all around the world. At this point, more than 30 million cases have been reported here in the United States, and of course, over 550,000 deaths. But what I can say is that the past 3 weeks, we've been experiencing increases in cases. Way down from where we were in the middle of January, but we're seeing some increases now. We're seeing increases in hospitalizations as well. But it's not the same everywhere. There are about 17 states that are seeing drops and about 19 where things are going up. And the increases, we think, are in younger people who haven't yet had a chance to be vaccinated, in people who may not be taking advantage of the mitigation that we know works, wearing masks and staying away from crowds. And we're seeing some outbreaks that seem to be related to extracurricular sports activities and the like. But the great news is that we are at a rapid clip of vaccination with more than 3 million people getting vaccinated each day. And we know that the vaccines are highly effective and safe and really are protecting everyone who's getting them.
And quite honestly, one of the people we have to thank for that is right here in this panel, and that's Kathrin. And I'm sure I speak to for everyone when I say thank you so much for all your hard work in the last year and a half. I got my Pfizer vaccine on Sunday, and I told you guys before we got on here that I just burst into tears when it was over. It was just like this cathartic experience, and I truly, deeply thank you for that experience. Something that Anne also alluded to is the rising cases, and part of that are the variants. And I wondered, Kathrin, could you discuss what Pfizer is doing in terms of their vaccine and the variants and booster shots?
Yeah, thank you, Alex. And first of all, thank you for having us all on the show. It's much appreciated. Nice to see some colleagues that, like Anne, that we have been interacting with over the years. So yeah, obviously, it was very clear pretty much from the beginning that since we're dealing with an RNA virus, that we would probably encounter mutations. And that happened very early on and continues on an ongoing basis. So one of the studies that we're actually doing is monitoring the variants very carefully and then asking the question whether our vaccine-induced antibody responses are able to neutralize those variants. And we have published some studies already. In the beginning, there was a lot of concern about what we call the B117 variant that was very widespread in the UK. We tested that very quickly and found that our vaccine-induced antibodies were perfectly capable of neutralizing this virus variant, very efficient. We have them built on this and tested a number of other variants. It's all published, and we updating the information as we go. So far, we haven't seen what I would call truly a variant of concern, because so far we have demonstrated good neutralizing activity against all of them that we have tested. That said, though, and knowing that viruses can be very crafty sometimes, we of course need to also be prepared on getting ready should what I call the nasty variant, as I call it, really occur. And so we are getting ready to make sure that we have the pathway in place should we have to update a vaccine. And the last question, I think,
Kathrin, we haven't seen the nasty one yet.
No, I haven't seen the nasty one, and hopefully we'll never will. But this is hopeful, right? That we never do. But with hope, that doesn't help us. So we need to get prepared to make sure that if indeed it happens, we are ready. And then your booster question, that's a very important question, and maybe that's something that Anne can actually help us with as well. We are not sure yet whether we need a booster, when we need a booster. And so I think there's a lot of work that is currently ongoing to try to assess if and when.
Yeah. You want to respond to that real quick, Anne?
Yeah, just to say, remember, we're in the infancy with this virus. You can think about influenza, and we know we need boosters with that. The virus changes rapidly and so forth, but we're in the infancy with this virus and the world's knowledge. We've learned so much, but it's still pretty new in terms of what will natural or vaccine-induced immunity be like a year, 2, 3 later, and how many of these mutations will turn out to escape the vaccine protection. So we're also in the infancy of exploring how amazing our mRNA vaccine protection is. So I think it's too soon to say, but it's really important to be prepared.
So Priscilla, I feel like that's where you intersect here, because you guys have been doing so much work on understanding how the virus spreads. Can you walk us through the work that you're doing in California on that?
Yeah, a little bit more than a year ago now, everyone was talking about the need to test for coronavirus, and that we simply just in communities didn't have access to testing. And what we at the Chan Zuckerberg Initiative, the BioHub, and UCSF put together a testing lab in a time frame that was unprecedented, 8 days. We were so excited to do that. And then I have to tell you, it landed with a thud. No tests came in, I would say, for the first 2 weeks. And a couple lessons learned there. One is our public health departments or have been historically underfunded, have been underconnected to tools, academic research, innovation, resources, frankly. And suddenly, all 58 of these departments in California were in the middle of needing to respond to something that none of us had the playbook for. And so what we were able to do is partner with the departments of public health to ask, we called them, we got in touch, and we said, how can we help? How can we modify this? How can we change our resources to actually meet your needs? And that's when our ability to actually test and meet the needs of, in particular, the underserved in California actually took off. And then once we sort of got that under our belt, what we started doing and what others have alluded to is taking advantage of that consistent rate of mutation that we see in coronavirus because it is an RNA vaccine. And what we could do was, if we sequenced the virus, we could use a form of genetics as an epidemiology tool to actually track transmissions, because we knew it would mutate about every 1 to 2 transmissions in the community. Early on, we used that to be able to say whether or not the strain passed between, if there were linkages between outbreaks. For instance, if there were 2 nursing homes, was it a similar enough strain where we could try to draw a connection that connected the 2 groupings? But as we see now, it's become incredibly critical that we monitor the presence of variants in the community very carefully, both for known variants and seeing what percentage we're seeing of variants we're seeing in any given community, and looking out for the scary one, as Dr. Jansen said, because we like, knowledge is power here. We need to be able to see that. And at the BioHub, we've partnered deeply with the departments of public health to actually do that as a tool, as a service for them. And now we're in the process of training the departments up so they can do this in a independent, sustainable way within their lab. But at one point, the BioHub accounted for 45% of the state's sequencing efforts and about 5% national.
That's incredible. Fei-Fei, I'm going to get to you in just one second. I just have a follow-up for Priscilla on that.
No problem.
So what are you noticing on the ground now? So Anne kind of gave us a picture of where we are in the U.S. So what are you noticing, like, day to day?
I would say that, at least in California, people are, where I am at, people know how to access their resources around masking, about the non-pharmacological interventions. Mm-hmm. But we are still in the uncomfortable, we're in like the teenage years of, I'll use a pediatrician example. We're in like the awkward teenage years of like, okay, we don't need to be like shut-ins anymore because we sort of know some things to keep us safe and some people are vaccinated. But at the same time, this is a point where we need to be pretty careful because the teenage brain sometimes does scary, silly things. And we need to be careful in this transition so that we don't actually trigger a 4th wave.
Right. So just to be clear, we have the infancy of the virus and mutations, and then we have the teenagedom of our actual social reactions. And if we use that analogy for the vaccine, yeah, Kathrin, where are we? Are we also in the infancy of vaccines in relation to COVID?
I don't think so. I think we have been much more successful at the end than what any of us ever would have imagined.
So midlife?
And so, like in life, I would say it's probably, some wise adults.
Wise adults. That's a great analogy, guys. I'm really appreciating it. Fei-Fei, you are a pioneer in the AI world, and we're doing a lot of work on that when it comes to healthcare, not necessarily COVID related when it comes to healthcare. Could you lay out the work that you've been doing?
Yeah, thank you. And it's what an honor to be with these incredible women. So, COVID really has fundamentally changed the way even technology is being used in not only work in general, but also in healthcare. It's been accelerating the way telemedicine is applied and being thought of. And in my work in AI and healthcare, we have been working on this idea of ambient intelligence, which is using very smart AI sensors to help assist clinicians to keep patients safe, both in the patient rooms as well as at home, as well as making sure desired treatment or early diagnosis of changing conditions happen in a timely manner. And before COVID, I would say this was very early, still in the lab kind of research work. But COVID has accelerated this so much that hospitals and companies and of course basic science labs are doing a lot of work. We keep using the analogy from infancy to adolescent to smart adults in this whole COVID conversation. Well, I have to say the population I care the most about are actually aging population. And in our research, we're seeing that COVID has a huge impact on them, not only the disease itself, but also how to manage chronic disease in a pandemic. How do you keep seniors at home safe and ensure their well-being, both mental well-being as well as physical well-being? How do you ensure they stay connected when families cannot be traveling so freely? And these are the kind of work we see that AI can come to help. With ambient sensing technology, we can connect these patients with clinical care in ways we could not have imagined.
Fei-Fei, can you give me an example? Can you give me an example of how that would work?
Yeah. So, for example, mobility is a big deal in aging stage. The changes of gait, the lack of mobility, or the changes of activity patterns, all can indicate risks, whether it's a fall risk or it's a chronic disease exacerbation risk. How do you keep track of mobility changes? It's very, very hard. You cannot possibly use an iPhone to log that or rely on a caretaker. So then imagine smart sensors that respect your privacy will be a pair of eyes or like a guardian angel that continues to log information of changes of mobility for patients at home. That's just one example that could become very useful for taking care of seniors. But there is, other situations like early detection of infection, sleep pattern changes, dietary changes, and many other things that AI technology can be of a helpful assistant to our families and clinicians.
So the idea is that AI can detect changes in somebody, and then that might alert their doctor that something may be wrong, or you can get prevention faster, or you can get to medicine faster. Is that kind of the idea?
It is. We actually call it the illuminating the dark space of healthcare. Is that a lot of health risk situations happen when there isn't someone looking after the patient, and if you configure the technology in a respectful and right way, and by preserving privacy, you can use this 24/7 as tireless assistant to our doctors and clinicians to make sure our patients are safe.
That's amazing. You guys must not ever sleep, I think is my takeaway so far in the last like 15, 20 minutes. So I also wanted to take a look at sort of what you're working on next. And a lot of that's going to relate to what we've already talked about. But, Kathrin, you already alluded to the boosters, you alluded to tracking the variants, et cetera. And I'm wondering, can you walk us forward a couple years? And do you envision yearly mRNA shots for COVID wrapped in with a flu shot? What's like the next gen of this?
Yeah, I think there's actually a number of opportunity that this new technology has opened up for it. Anything, of course, related to COVID, Alex, we already spoke about this, right? Potential boosters, making a combination. Let's say there is a yearly booster required for COVID. You have then the opportunity maybe to combine it with a seasonal influenza vaccine. So I think those kinds of combinations and approaches, it's pretty straightforward and actually very, I think, easily achieved, I guess, knowing what we now know about the platform. But then you can think about this also wider than COVID and maybe wider than influenza, assuming that you would need a booster for COVID. So you can think about all kinds of other diseases that we may have either not been able to find vaccine against. And I'm a vaccine person, so I'm thinking vaccines here first of all. And with the power of that RNA platform, it opens then opportunities to go into other areas that perhaps we weren't able to address in the past with what I call older technologies that are still very valid, but may not have been able to address certain diseases. So there's a number of infectious diseases that you can now look at and ask the question: well, with that new technology, do we have an opportunity now to address those diseases as well?
Amazing. We're talking like Ebola versus like Alzheimer's, right? Or could it be, or cancer, or can it be all three of those things eventually?
Well, I looked at this first from a standpoint of infectious diseases. I'm a microbiologist by training, so I always have a mighty respect for the microbes, including viruses and everything else. So maybe what you know best, you're most concerned about because you know all their tricks. And so, but you're right. I mean, one can think about, using the platform for a number of different, what I call therapeutic areas, different approaches. Cancer comes to mind. There's a lot of work that has happened already in the oncology arena. Recall that our partner BioNTech actually started working with RNA vaccines, close to a decade from now, looking at treatments for cancer, and they have advanced a pipeline, a clinical pipeline for that. So this is one of the obvious things, and then of course there are potentially other approaches that you can think about to get to use the RNA platform as a delivery vehicle, for example, to deliver whatever antibodies, therapeutic antibodies, or it opens up a whole I guess host of other potential approaches.
It's honestly truly amazing that we can get to that place. So to stay on using what you learned and been doing during COVID and moving it forward, Priscilla, I'm wondering, something that we're dealing with in the U.S. is vaccine hesitancy. I got my vaccine in Staten Island because that's a lot of Trump country and they're not going to get vaccinated. So there's a definite disparity in vaccination in the U.S. and just forget about Europe for a second. Priscilla, what are you guys doing at CZI about that? What are you next working on, COVID related or not?
Yeah. So starting in the fall of last year, we started moving out of reactive mode on sort of how to stabilize communities to looking forward of how we knew vaccine hesitancy was going to come. Because there's just a lot of complicated issues here. And you just heard from one of the foremost experts in the world, and it's super exciting. It's super compelling. I can't wait to get mine. At the same time, we're all super data-driven people. I'm a data-driven person. When it's for yourself or for your kids, you naturally have more questions. And I'm thrilled for my kids to get vaccinated too. But in our country, we've just had a long history of systemic inequities, in particular for Black, Latinx, Indigenous communities of color, where, maybe there's less hope that they'll have access. Maybe there's historical distrust. Maybe there's just not a relationship with our healthcare system. And so we started thinking about how do we help advocate for equitable distribution of the vaccine? How do we get communities that most need a little bit more time to get comfortable with the vaccine, to get on board with vaccination? And this is a scenario where every additional person who gets vaccinated makes their entire community safer. And so we invested in the Made to Save campaign that just launched yesterday. It's a national public education and organizing efforts to help get the right information in a way that's accessible and culturally relevant to the communities that we most care about. And the interesting bit there is that, yes, it's a national campaign, but actually the people that need to be the voice aren't necessarily, like the five of us on this call. It's your pastor, it's your neighbor. Like, even, when we first started this call, we're like, how'd you react? What was that like? And getting that local trusted voice to give you what is completely shared and validated information helps people feel like they can ask and they're getting the right information that they need. The other bit that we're doing is working with the Kaiser Family Foundation to help figure out what the right messaging is. What do different communities disproportionately care about? And one example is Unidos en Salud, which is a community-based public health effort based in one of the hardest hit neighborhoods in San Francisco that is working in both communication, sharing information, and delivery in a way that actually meets the needs of the communities that they're trying to serve.
And do you support them? Is it financing? It sounds like, though, it's maybe financing, but also just like working as a partner and help develop at the same time, yeah?
Yeah, so it's financing. It's helping drive research. And then when, now that Made to Save is ready, we are now pairing them with the community-based organizations that we've long had relationships with in the Bay Area, throughout California, to make sure that we have this sort of branching network that actually meets the needs of individuals, not just demographics.
How long until you know if it's working? When do you know if it's working or not?
Well, I think that's where you start. You can look at sort of local initiatives. How is Unidos en Salud doing? How is this X community doing? But exactly what you referenced in your question is that we know at baseline there's different levels of acceptance of the vaccine by gender, by political orientation, by racial background. And we are continuing to monitor whether or not we are seeing populations change their mind. In our research, we're seeing that people who are on the fence actually moved, and they very quickly, people who moved to on the fence to, yes, I'll go get the vaccine when it's available to me. The harder part is going to be people who never considered it. We're not seeing a lot of movement there yet.
No, that's a fair point. And what about you? Where do you see the herd immunity conversation evolving in the U.S.? And I'm also really curious as to, you've worked on epidemics before. This is not like your first rodeo, maybe like a really big rodeo, but it's not your first one. So I wonder, do you feel like the U.S. is prepared? Or are we different now? Like, what's your view on how we're going to be able to function next time, and what you're working on to deal with that?
Yeah, I think the principal thing that's changed in terms of how prepared we are is that we don't have a false sense of confidence that we're different, that nothing's going to happen here, and that we're all ready for everything. We obviously have had enormous challenges, and it's been a devastating experience for the country as well as the world. So I think we have a pretty long list of what needs to be done, and Priscilla already mentioned, the investment in public health. We know that our local and state public health was not ready for this, that we were not ready on the laboratory front, whether it's the public or the commercial or the clinical labs, to surge. We were not ready to innovate. We don't have the workforce with all the skills and ready to scale. And so there's a huge amount that needs to be done. And I think there's a broader recognition that public health is important and that we all depend on it, and that strengthening public health, addressing the supply chain, linking healthcare and public health, and really embracing the data era is going to be critical. So I think there are resources now that are helping, but obviously we're still in the middle of this pandemic. So it's tackling where we are as well as getting ready for the next. And you know that the next threat will not be the same. The challenges will be different, but it's pretty predictable that the health inequities we're seeing now that we've had for generations need to be taken seriously, need to be invested in. So I think we have a lot of work to do. But I think just on the herd immunity issue, and kind of picking up on the vaccination hesitancy, as more people get vaccinated, more people are confident about getting vaccinated. And it's really understandable that there were a lot of people who were wait and see people. They haven't been studying mRNA vaccines as long as Kathrin has, and they haven't been thinking about, how strong is our vaccine safety system. But as every, day more people get vaccinated, more people know people who've been vaccinated and they're doing okay. And we're gaining more and more information. And so I have so much respect for people trying to make good health decisions. We have more information to share that hopefully will be reassuring to you.
In terms of information, something that we all are battling is social media and disinformation. And how do you deal with you've had a tremendous few years. Like, Washington, D.C. has not been an easy place to function, I am sure, particularly in the CDC. How do you deal?
Well, I think that, this experience has, it's been hard for everybody, nothing special about us here at CDC, but one of the things that...
You can claim it.
Well, we are special. We're special. We have wonderful people here, and they're incredible. But I think that there has been such an intense competition for the truth, that we've seen in this past year. And it has been challenging to feel like there are multiple realities or multiple versions of the truth. And so, I think credibility is critical. And at CDC, we really strive to be credible. We want to be honest and transparent and empathetic, but we want to lead with science. And certainly our agency is a data-driven agency that's trying to get the best information out there for people to make good choices. But it has been challenging to get that information out and to have a voice. But I think that the way that I deal anyway is, strength from the team of incredible people that I work with and the people that we serve, the partners that are out there, especially the frontline folks in public health or in healthcare, and knowing that what we do really matters and we have to keep going.
I truly hope that part of it gets a lot easier now. Fei-Fei, you are doing a lot of amazing, innovative work with AI. ImageNet is one, and I wonder if you could walk us through kind of what your work is, what that is, what the future of that looks like.
So just like everybody says, this disease and our understanding of it is still relatively young. AI is also a very, very young field. It's only about 60 years in history, and a major scientific discipline like biology or chemistry have hundreds and hundreds of years, even in the modern era. So there's a lot of basic science work we need to do. Just continue on the example of AI for assistive care for our patients at home. Technology from understanding language to understanding the human movements to understanding nutrition, objects, intake, all the way to robotic technology to become assistive. All these require basic science research. And that's one thing our lab is definitely focusing on is vision and robotics-based basic AI. On the more healthcare front, again, I cannot overemphasize what a every time there's a crisis, there's opportunity. COVID has really opened up a technological opportunity in medicine to help people, to help our aging seniors, to help our patients at home. And this technology needs to, it gives us a window and a motivation to work on technology that can directly benefit them. But in order for that to happen, it needs to be safe. It needs to be respectful. It needs to be nuanced enough to understand our patients' need, our clinicians' needs. And this is what I'm truly excited at Stanford. We're working with doctors, nurses, bioethicists, legal scholars in looking at this holistically from both technology point of view as well as ethics and policy point of view to ensure we can move the technology forward to help people, but also mitigate any potential adversarial consequences.
What's a bioethicist? This might be a really dumb question, but what is that?
A great question. Actually, I think they do very important work at Stanford. We have phenomenal colleagues. They are, even as early as the DNA days, the genomics days, and also, medicine in general, we need to understand the ethical implication of let's say clinical trials. We talk about equity and fairness. We talk about safety. And now we move into modern era of technology, privacy, security. And, as a computer scientist, I don't pretend I have all the expertise, and bioethicists are trained experts understanding these factors, and we work hand in hand with them along the development of technology.
I could talk to you guys for like hours. I'm told it's the Q&A part, so now I have to share the stage. So one question, Kathrin, is for you. And I guess Anne and Priscilla, if you have any other details on this, you can feel free to jump in as well. But the question is, what's known about the length of time, the protection of existing vaccines? Does efficacy trail off, especially for those who are older? I'm sure that's tricky to say because they haven't been around that long. But Kathrin, why don't you take a stab at that?
Yeah, that's actually a very important question, and it's something that also goes into the question that we asked earlier: is do we need a booster, and if so, when? So we have been recently we made a press release, and the data will be published soon, where we looked at a persistence of our vaccine protection. We now have up to 6 months after the vaccine administration. And so what we have seen is actually that the protection kept up pretty well, but you can, if you carefully look at the data, you see definitely not an upward trend, but you see that it, kind of goes down. So what we're trying to understand is, can we use some kind of modeling? Because now we lost our placebo control arm, right? Because we felt it was, again, this is the ethical thing to do. Our trial participants enrolled in the study, and we said, of course, if we would be successful, we would roll them over into and have them vaccinated. That's the right thing to do. But the problem with this is now we are running without a control arm. So we now have to use models, and I actually would invite Anne to say a few things, because you guys are always very good in trying to predict the future with your sophisticated models, how we can use real data from the field now to give us information of what is happening to the persistence of vaccine protection. Because again, we want to be ready if there is a decline, that we then have the evidence to go to our friends at the CDC and say, are we ready to boost? We want to boost. Maybe we need to boost. And so I think this is really, really an important question, and something that we all together are working towards, to have an understanding of the ways and the means, and to develop those models and the ways and the means to determine how long vaccine protection lasts. But maybe, Anne, you want to add something to that as well, because that's part of your business too.
Just to say that it is too soon for us to understand really what the duration will be, but we're intensely trying to follow the vaccine effectiveness in real life, basically not in the clinical trials, but what's going on as these vaccines are used more broadly. And so far, the results are terrific, but they're not really getting at duration of protection yet. There are efforts, though, to study what we call the breakthrough cases that occur after a person has been vaccinated, so that we get a better understanding of, is it a variant infection perhaps, or is it a particular situation with the individual? Even with something that's 94% protective, you're going to have, if you vaccinate millions and millions of people, there's going to be thousands of people that get infected after the vaccine. But we want to understand if it's happening more than we would expect. And so far, everything looks good. But of course, the widespread vaccination is pretty new.
I'll take it, though. I'll take it. Priscilla, have you guys noticed anything along those lines that you can add? Yeah.
Sorry?
I said, Priscilla, are you guys doing any work on this that you can add to that in terms of duration?
No, we're not studying this, but I have follow-on questions for Anne and Kathrin.
Go for it.
Well, I'm curious why we would need a control group to study the duration of protection from the vaccinated group.
I'll give you my perspective of this. I think it's the easiest way to get a quick assessment of what's happening to your vaccine protection. And I give you a good example. When we started out and did our first analysis to file for the emergency use authorization, we had what's called a Kaplan-Meier curve, where we see the placebo recipients, and they kind of were skyrocketing, and we saw the vaccine recipients that were essentially almost flat. And those two curves very quickly separated after about 12 days or so after the first dose. So we could actually monitor very quickly using the what we call the placebo arm and saw the development. Now we lost that placebo arm, so I think it becomes more complicated, not impossible, but I think from my perspective it's probably more complicated to get to those data quick with what Anne calls real-world data than what we usually can see, in our placebo trials.
Real cases, not looking at antibodies and serum or anything like that. That's your preference, to look at real cases.
Yeah. So my preference is it's really the vaccine efficacy that we are after here. I think the what you mentioned, Priscilla, neutralizing antibody, for me is a proxy. Perhaps for vaccine efficacy, but we're already seeing it's definitely not a perfect proxy, and that there are other factors of the immune system that get triggered by the vaccines that are also come into play. So it's rather complicated, and so it would be nice if we have a perfect correlate of protections. Can say, yeah, we know exactly when that happens, we need to boost or whatever. Unfortunately, that is not the case. We are not there.
We'll get there. We'll get there. Yeah, we'll get there. Anne, did you want to add to that?
Yeah, just I was going to say similarly, sometimes we have a correlate of protection and we can measure antibody or that correlate and figure out where are we, and now we need to boost. But often we don't, usually we don't, especially at the beginning of a vaccine disease kind of assessment. But we've used case control methods in sort of real world to try to measure vaccine effectiveness, and often with multiple vaccines have been able to show waning of protection, suggesting the duration is limited and there's a need for a booster, or possibly, like with varicella, there was a need for a 2-dose series, not a single dose series up front.
We have another question from the audience for Kathrin. I don't totally understand what it means, so hopefully it makes sense. What role did a cryogenic electron microscopy, cryo-EM, play in your initial vaccine development and in dealing with the new variants?
Actually, that is a very interesting question, because the cryo-EM technology is a very new technology that allows you to look at structures of proteins, for example, on a, like a virus protein, like the spike protein, as it's expressed on a cell. So you can deduce structural information from cryo-EM pictures. You can see if you can look at vaccine formulations, for example, and compare them and see how they compare when you do stability studies. So it's a very useful technology. In the beginning, though, we have not benefited much from the cryo-EM work because we were really intent of studying immunity of our vaccine candidates, because that was the most urgent thing, to just take those constructs, get them into the clinic, and ask the question, do we have an immunogenic vaccine or not, and what is the right construct? And we did that clinically for a good reason, because that's what we really need to measure. If you have an assay that is, again, a proxy for a potential clinical result, you have to validate all of this. And so we were very intent to really generate clinical data very quickly to be able to move ahead with our vaccine candidate.
Okay, good. I'm glad that was a good question. So that also means that you're more interested. There's another question about cellular immunity in trial participants, as well as the antibody response and what you were monitoring. And it seems like it was the cellular immunity is what you were monitoring.
We did monitor both. The beauty, as I call it, of the RNA vaccine and really the reason why we were very intent on putting our chips or our bet on that platform was that we knew that it triggers multiple arms of the immune system. So you get good neutralizing antibodies, you get an innate response, and you get T cells. And so we liked that, not knowing what exactly it is that we need finally for protection, we wanted to make sure that we tick all of those boxes. So we monitored first neutralizing antibodies, but then we also looked at T cell responses. And what we found in our first phases of clinical evaluation, that indeed what we had seen preclinically, and also our partner BioNTech had seen it in early clinical oncology studies, that indeed the vaccine candidates were able to induce, strong immune responses, innate responses, antibody responses, and strong T cell responses. And, maybe going a little technically, but there are two kinds of T cells that we look for usually. Helper T cells and the kind of T cells that is able to kill a virally infected cell. And we were very pleased to see when we did the evaluations that we got both of those T cells. Of course, we got the nice antibodies and other innate responses that were very helpful for preventing viral infections.
Unfortunately, we do have to leave it there. I truly appreciate your time, your hard work. You're truly inspiring, and thank you for trying to make everyone's lives better. I cannot express enough how much that means. Thank you very much, everybody. Okay, now we want to look forward and to the building the future and the pipeline.
At the end of 2017, we decided to take a hard look at the actual numbers, both in terms of our representation and our stories, but also on our TV programming and our radio programming. And the numbers really surprised us. About 10% of our outside guests that were brought onto TV were women.
I think we all can agree that the industry would be far better off for being more diverse.
What we heard from the bookers was that either they said that they couldn't find the women, there weren't women in the right roles that they were looking for, or if they found the woman didn't feel comfortable going on TV. And we thought the one thing that we could actually impact was this issue of the training. And we created an initiative called New Voices in 2018 to offer 4-hour one-on-one training for each woman that we brought in, to give them some video experience, some feedback, to learn about their messaging.
This is what I would say. I think quarterly earnings, we all get extremely focused. It's a really good training. And what I really learned is just understanding sometimes you may not want to answer that question and just being able to pivot to something else entirely and getting your point across.
Something that really impressed me about this initiative is that it is without any expectation and the program is fully confidential.
It's not necessary to go on Bloomberg TV after this. The idea is that you will be TV ready to voice your opinions, to share your perspective. The ultimate goal from a journalistic standpoint is that we have better programming, that we have more interesting conversations at events, and hearing opinions that we may not otherwise have voiced.
The only way to really achieve those goals is to have that representation within the financial news.
So we've more than doubled the percentage of women experts on our TV and radio.
Why do you think tech executives are putting their money and their muscle behind this now? I see the difference when we have more female voices on our show. There are new ideas, new insights.
Anyone really who's looking to grow professionally in their career is a fantastic opportunity to take up.
Hello, I'm Laura Zelenko, Senior Executive Editor at Bloomberg News and founder of our New Voices Initiative. And I just want to say I'm personally so grateful for and proud of our partnership with the Smithsonian for this event. To first celebrate the female pioneers in science and technology, and then to hear such an inspiring and moving conversation with many of the industry's greatest experts in the room. All of them women of extraordinary accomplishments. So thank you to everyone for their participation in this wonderful event. And now we want to look to the future. Through New Voices, we are putting a spotlight on the lack of representation in the industries we cover most, including technology and science, and uncovering the hidden experts whose voices need to be heard. Executives who have gone through the New Voices program have appeared on Bloomberg TV more than 800 times. And beyond that, they have also participated in stories and segments with other news outlets, showing media audiences, and even more importantly, the next generation, new role models who provide expert opinions on these hard news topics. And we do this work because it matters to our coverage. Diverse sourcing helps ensure we are fair and balanced. It helps us limit our blind spots and our biases. It makes it more likely that we won't miss important stories on our beats or dismiss important perspectives in our storytelling. And at Bloomberg, this challenge is even more significant given our focus on industries that themselves are struggling to diversify their upper ranks. It is for this reason that we as newsroom leaders need to be intentional on raising the visibility of our female corporate executives and other underrepresented experts, and shift what has been a homogeneous narrative of finance, business, and markets from predominantly white male sources. Today, we are opening applications for a third round of Bloomberg-sponsored media training in San Francisco for senior women executives in technology, science, finance, and other industries in the area. The application can be found at www.bloomberg.com/newvoices. Now, Bloomberg is also hard at work on girls in STEM and at addressing representation across industries more generally. So now I'd like to introduce my colleague, Evelyn Erskine of Bloomberg Corporate Philanthropy. And afterwards, we have a very special guest to close out the program from the Smithsonian, Ellen Stofan, the Smithsonian's Undersecretary for Science and Research and the former director of the National Air and Space Museum, my personal favorite for all of its wonderful innovation. So over to you now, Evelyn.
Thank you so much, Laura. At Bloomberg, we are committed to making the fields of finance, data, technology, and news more accessible to historically underrepresented communities. And together with Bloomberg Philanthropies, we're working to invest in and support women around the world. We do that by working closely with an incredible network of organizations that open doors for career paths that many women and students of color may not have been exposed to. We connect those students with our talented employees who are eager to inspire and share their knowledge and their experience with the next generation of future technologists, data scientists, engineers, and journalists. Bloomberg supports organizations that focus on women in STEM, such as the National Center for Women and Information Technology, Girls Who Code, the Anita Borg Institute, Grace Hopper, but I wanted to quickly highlight our partnership with Breakthrough Tech, a New York City-based nonprofit born out of a collaboration between Cornell Tech and the University of New York. Every winter and spring, we welcome groups of young women studying STEM, and they become embedded with a Bloomberg team. They work on projects where they can apply their technical skills in real life and work and learn what it's like to be a woman in tech in the private sector. Throughout the year, these young women take part in professional development panels, resume workshops, trainings to improve their technical interview skills, all while being coached by Bloomberg engineers who are helping them navigate their path towards a career in tech. These programs have become our largest pipeline for technology internships at Bloomberg. We work closely with our diversity and inclusion recruiting teams, as well as employee communities such as the Bloomberg Women in Tech community, BWIT, our Bloomberg Black in Tech, and our Bloomberg Latinx in Tech, where different generations and diverse voices come together to support each other through different points in their career paths. Exposure to women role models, particularly in the STEM fields, is increasingly important. And it's why discussions like today's and the partnerships that elevate women leaders, like the Bloomberg New Voices program and our programs with the Smithsonian, are so critical. So thank you so much for being part of today's session. And I will now turn the floor over to the Smithsonian's Ellen Stofan.
Thank you for an inspiring program. I can't hear enough about women and girls in STEM. There is a bright future ahead for all of us, that is for sure. I'm Ellen Stofan, the Smithsonian's Undersecretary for Science and Research. This is a new role for me. Until recently, I was the John and Adrienne Mars Director of the Smithsonian's Air and Space Museum. I'm honored to be part of the Smithsonian, which has served the nation in times of crisis and times of great triumphs and discovery for 175 years. We provide scientific and historical context and advance understanding of what it means to be American in a changing world through our collections, exhibitions, research, and education programs. Our mission is more relevant than ever, especially in this current moment. Later this month, we are launching a public health campaign in collaboration with museums and grassroots organizations across the country, joining our voices and reach to increase awareness of the benefits of immunization and show throughout history how vaccines have paved the way for healthier communities everywhere. The women highlighted today strived for nothing less than thriving communities that value access to and representation in scientific inquiry and innovation. This is particularly personal for me. In my own path in science, I found hearing stories about people who studied geology across the solar system and beyond made me say, that's what I want to do. But when I was an intern at NASA, very few people looked like me. Today's Bloomberg and Smithsonian program illustrates how many female role models there are and how the world needs to hear more about them in ways that are truly inspiring and transformative. Through the Smithsonian's American Women's History Initiative, we want everyone coming through our doors, both digitally and in person, to see themselves. We especially want girls to know that nothing should hold them back. How are we doing this? Paid internships with the Women's History Initiatives and our museums and research centers throughout the Smithsonian. Exhibitions that showcase women of all ages, defying technological, societal, economic, and other barriers to achieve, invent, and change the course of history. I invite you to get to know the women in our National Museum of American History's Picturing Women Inventors, which is now a poster show that will be distributed throughout our more than 200 Smithsonian affiliate museums across the country and is available online. And we are helping to build the confidence of girls through hands-on science. Our She Can summer camp at the Air and Space Museum introduces middle schoolers, especially from underserved populations, to the thrill of science by experimenting with indoor simulated skydiving, launching a high-altitude balloon to analyze flight data, and so much more. These experiences literally change kids' views of their future. We know because they tell us so. I like to imagine that the first girl to walk on Mars was inspired to pursue space travel by what she learned at the Smithsonian. Please join us. Thank you.
That wraps it up for us. I'm going to go home and hug my 6-year-old daughter who just finished her STEM class. A big thank you to the Smithsonian Museum for partnering with us this evening, and an extra big, huge thank you to Kathrin Jansen, Fei-Fei Li, Priscilla Chan, and Anne Schuchat for sharing their experiences and all of their work. Now, here's how you can change the narrative. There are some links on the screen. So to find out more about the New Voices program, which will be accepting applications for San Francisco starting today, and the Smithsonian's Women's History Initiatives. Have a wonderful evening, everybody. Stay safe. Good night.